Welcome to the Lean Introduction. This will be a short video for what you need to know about Lean. This video will be a short 15-minute opportunity for you to learn about a continuous improvement methodology called Lean. My name is Pavelka, and I'm one of the improvement advisors through the Compass PTN or the Iowa Healthcare Collaborative. And we're available to help you transform your organization using the Lean methodology. So let's get started. What is Lean? Lean is a systematic approach of analyzing the flow of information, process, or materials in order to eliminate waste while striving for continuous improvement, ultimately to achieve value to the customer, or in many of our cases, to the patient. It's another way to think of it as the elimination of wasteful processes and waste within process. Lean is a continuous improvement methodology used to be able to help your organization become more effective and efficient in the services that you can provide. Lean can be used anywhere throughout the organization and is a hands-on way for your individuals in your practice or in your organization to be able to transform the work that they do to increase that value. One thing that I do want to mention is what Lean is not. Lean is not a way for you to reduce the organization's headcount. So when we talk about your organization uses Lean, it doesn't mean that we get leaner in regards to the number of employees that you have. Some organizations have considered the way to reduce or to actually save some cost is to let individuals go through this. I will grant it, your individuals become more productive and more time available for the things that really need to get done. But if you find yourself thinking, man, we have too many employees in an area because of your Lean efforts, think about redeploying those individuals to other places in your organization which truly do need more manpower. Lean is also not for companies where leadership has to be involved in every single decision or in every single opportunity they have to interject their opinion. Lean is a very bottom-up, if you will, where the individuals that actually do the work are the ones that are deciding how to change the work. Now, this doesn't mean that they don't have boundaries, they don't have goals, and they don't have, if you will, the parameters in which they need to stay in. Those are given by leadership, and those are created prior to you looking at the work. But ultimately, how we change the work and how we design the work to become better or more efficient is really done by the individuals who perform the work. And last but not least, Lean is not a one-shot quick fix. There isn't going to be a purple magic pill that helps you within your organization. You have to be able to work through the cycle of continuous improvement, often many, many times, to be able to get the answers or to work away the layers of inefficiency that have been created in your organization. So if you think you're going to spend 15 minutes or even a couple days working on something and it's more efficient and more effective, you're probably going to sell yourself a little short. You need to spend much more time ultimately to create a lean organization. Lean focuses on the triad of services and management. So often management comes to us and says, we have to increase the way that we deliver our services, or the quality, if you will. They may focus on doing more, getting more, having more. That's the delivery or time. And then last but not least, often management may focus on the cost of delivering those services. Well, Lean looks at those three things as well and says, within our services, how do we continue to increase our quality, drive down our cost, and deliver more effectively or more efficient? So by using the Lean methods, you're going to be focusing on these three areas: cost, quality, and time. And you have the opportunity through this methodology to be able to balance those three, ultimately to provide more and more value to your customer. There is a systematic method, as I mentioned earlier in the first slide in the definition, of how we do lean, or how we are able to look at a process within your organization. Here on the slide, you can see the steps to work your way through a process improvement opportunity or cycle within lean. If you're interested in how to do more of this, please stay tuned or listen to the 1-hour presentation about lean methodology, which goes into more in-depth opportunity to focus on each of these. But just real quickly, as I mentioned earlier, we focus on value. So the first step, focus on what is the customer, or in many of our cases, the patient, define as value. What is it that they want? Second, we map or look at the value stream of the process. So how does that process currently flow? Then we look at the actual flow. Is there opportunity to be more efficient and more effective? The fourth step, very similar into many of our other process improvement methodologies, we hope to eliminate waste, or the things that have actually caused bottlenecks or barriers within the organization. And then last but not least, we strive for continuous improvement and standard work. So we look at how can we continue to do this better in the future. So this very simplistic process, or these step-by-step directions, are one opportunity for you to be able to improve your organization each and every time you take an opportunity to do process improvement. Just a little bit more in depth about some statements I said earlier. One of the questions that always comes up to me is value versus non-value. When I mentioned a couple times earlier that we have this thing called value or value added, Lean defines these as any activity that increases the market for or the function of the service. So it's those things that our patients come and walk in our doors and ask for. Maybe that might be the opportunity for health and healing. Maybe it's the opportunity for wellness. But those opportunities that we have every time we interact with our patient to give them what they value is what Lean is striving to do. I also mentioned that we have the things called waste in our organization, also classified as non-value added. Those are the activities that do not add form or function, or are often not even necessary. They may have been necessary years ago, or even some opportunities years or many days ago, but today they do not add any form or function. In other words, they don't add any value to our services. And last but not least, there are things called necessary non-value. These are often things that we have to do in our organization to keep the doors open. They may be considered things like regulatory requirements, or even some opportunities that we have to do, such as tracking and data. They don't necessarily affect the patient directly, but often we need to be able to do them to be able to run our organization more efficiently and more effective. I also mentioned that there are these things called waste. There are 7 categories of waste that a Lean practitioner often looks for. Individuals within your organization can also continue to look for them. They're listed here, and you can take an opportunity to read through them and learn more about them. It's an opportunity for you to look at the work differently and think, how can I do this without having one of these waste? Can I remove, maybe it's transportation, the movement of items. Can I remove the amount of time that a patient or individuals have to wait for my services? Many organizations start their Lean journey by taking this list and looking for just these opportunities. They don't worry about any of the other tools. They don't worry about any of the process steps. They just go around and say, in my organization, where do these things exist? Where can I see them? And how we can use just simple techniques of maybe brainstorming to eliminate them. So if you're looking for a place to start in your Lean journey, you may have an opportunity to learn the waste and start with looking and identifying the waste within your organization. In summary, there are benefits of a Lean environment. There are things that will actually happen and occur within your organization that most leaders and most champions within the organization strive to get to. These opportunities of a lean environment and being able to build your organization will ultimately help your sustainability, your value, your quality to the customer, and have an opportunity to provide better satisfaction both to the patient or to the customer and your employees, and last but not least, see growth in earnings. We have an opportunity to be able to look at our organization and use the techniques of lean to gain many benefits. Some of these you may feel like you have a need for, and others may not necessarily be a goal today. But in the future, your lean environment and your transition to lean can help you in many different ways. We're excited to share your lean journey with you. Again, if you're interested in more resources, we can help you either through the Compass PTN or through the Iowa Healthcare Collaborative. Our contact information is listed here. Feel free to look at the other lean resources that we have in our lean toolkits. And if you have any questions at any point in time, feel free to give us a call or send us an email. Thank you today for your time.